Now, the current debt rate stands at 2.06% recovery and has jumped to 71.65% from just over 40%. What efforts are being put in place to check the spread and flatten the curve? Our guest today is the National Coordinator, Presidential Task Force PTF on COVID-19, Dr. Sani Aliyu, to discuss on the program. Dr. Aliyu, it's a pleasure to have you again on joining us. Good morning. All right. Very soon we'll be establishing, we'll get to continue conversation with Dr. Aliyu. Now join the conversation as well on our live streaming, as we're streaming live on www.facebook.com/Radio Nigeria Network, or simply search our website, Radio Nigeria. The lines to call to be part of the discussion this morning is 0807 622 6771. Once again, the line to call to be part of the conversation today is 0807 622 6771. The second line is 0705 149 3324. Once again, the second line to call on the program is 0705 149 3324. For SMS and WhatsApp only, send to 0705 864 2473. Once again, for WhatsApp only and text messages as well, send to 0705 864 2473. Please remember to turn down the volume of your radio set to avoid a holdback. Make your contributions short and straight to the point so that our guest can respond and we can as well take other contributors on the program. So, over to business of the day. I believe we've been able to establish connectivity now with Dr. Sani Aliyu. Dr. Sani Aliyu, are you with us? All right. All right. While we wait to establish ties with Dr. Sani Aliyu, let's take a few messages.
The National Center for Disease Control has informed me that a large proportion of new infections are now occurring in our communities through person-to-person contacts. So we must pay attention to the danger of close contact between person to person. At this point, I will remind all Nigerians to continue to take responsibility for the recommended measures to prevent transmission, including maintaining physical distancing, good personal hygiene, and staying at home.
As the roar of a lion reverberates across the animal kingdom, so does the news in the network service of Radio Nigeria reach all the nooks and crannies of Nigeria and beyond. Radio Nigeria, the strength of a lion in every newscast.
Una no vex. Una never hear of coronavirus. Prevention is better pass cure. See this hand sanitizer. Now one way to take prevent coronavirus with that. See, another one we say we can wash our hands clean with soap and with water. Another one we say when we want sneeze, I mean we want cough.
You do it into your bent elbow.
Then if it be like say you no feel well, whether na cough or I be you no feel breathe well, I be you dey feel feverish for this period. I beg make you take sign house. Then the one wey make I no feel hug you. And they call physical distancing. Nigeria, our culture they promote cleanliness. Let the celebration.
This message is from FRCN and NCAC.
Radio Nigeria, uplifting the people and uniting the nation.
Thanks for staying with us. The program is Have Your Say, coming to you live on the network service of Radio Nigeria. And today we'll be talking further on flattening the curve and checking the further spread of COVID-19 in the country. And indeed, we've had quite some statistics on the situation of the pandemic here in Nigeria. Our guest today is the National Coordinator, Presidential Task Force, PTF, on COVID-19, Dr. Sani Aliyu, to discuss on issues. Dr. Sani, are you with us now?
Yes, thank you. Good morning.
Yes, good morning, Dr. Sani Aliyu.
Good morning.
Now, let's just go straight. We've been waiting to establish times. Now, there were predictions in March that the COVID-19 pandemic may heighten if preventive measures were neglected by Nigerians. Is this the situation we are right now in Nigeria?
So, as you're aware, our numbers have risen over the last few months quite considerably. We've been testing a lot more, but we're also not very pleased with the level of compliance when it comes to prevention measures. I think overall the country has been quite lucky. We've been able to get away with it to a large extent in terms of both the number of infections as well as the number of deaths. This is possibly because of the nature of our demography, the fact that we don't have a lot of elderly people. But nevertheless, it still continues to be a major concern. Our testing numbers relative to other parts of the world, and in particular South Africa and Ghana, for instance, is relatively low. I believe if we were testing a lot more, we probably would have a lot more cases identified by now. Our priorities over the next few weeks really is trying to push through that messaging to the generality of Nigerians that this isn't over yet. Yes, the numbers have come down over the last week or two, but these are probably fluctuations that we would expect over a public holiday period. And certainly it is not over yet. It is not time for us to start relaxing and saying this is all over. We've got to continue to be vigilant. We've got to continue to take those protective measures such as wearing face masks, hand sanitization, maintaining physical distancing, because the virus is still very much around in our country.
All right, Dr. Aliyu, it's been in the media that the Presidential Task Force on COVID-19 will be issuing certain guidelines today. Are these guidelines going to be more stringent, or there will be some relaxation in one way or the other? What do we expect? Can you give us a sneak peek?
So I'm afraid we'll have to wait until the late afternoon. Yesterday we saw Mr. President, and we put through our recommendations that have always been data-driven and based on science as well. We know the interventions that work. We know the interventions that are not as effective. We're also very much aware of the impact of lockdowns and some of the interventions we've done in the past in terms of the economic impact on the generality of Nigerians. But nevertheless, the role of government really is to protect its citizens, to save lives and to save livelihoods. And this is what we intend to do. The recommendations that we will have later on today at our press briefing, as soon as we get the necessary sign-off and approval by Mr. President, will map across the usual areas, talking about general movement of people, also looking at the socio-economic side, schools, travel, and also things like recreation, etc. I cannot say at this point whether we are going to tighten or loosen up a bit, but the numbers themselves suggest what we'll probably do. The numbers are going up, but they are not going up as high as as high as we would have worried, to the extent of going back into a lockdown state again.
Okay, let's talk about the level of awareness at the grassroots. The Presidential Task Force is here in Abuja, and so far we've seen its activities. It has continuously, perpetually giving us updates on the situation in various parts of the country. How are you now engaging the grassroots, the local government, the wards, and so on, so that they can also carry out the necessary steps in further flattening the curve?
So this is a very important point, really. when it comes to pandemics, especially pandemics where you do not have a vaccine, where you do not have a drug that can prevent transmission, the only thing that can stop the pandemic is behavior change. And behavior change in itself is challenging. You require to have messaging that fits in with the audience that you're trying to target. With COVID, the problem with COVID-19 is it's not behaving like the usual sort of pandemic that we have. In what way? What I mean here is the majority of people catching COVID will be relatively well. We do not have people bleeding to death as with Ebola, for instance. We do not have dead bodies mounting on the streets, such as if you have civil strife, etc. So that visibility when it comes to the impact of the disease on the generality of the populace is just not there for most people. COVID kills particularly those that are vulnerable, those above the age of 65, those with diabetes, hypertension, etc. So the messaging that we have to put out has to change. It has to fit in with the reality of the disease itself. And that messaging is all about protecting our loved ones, protecting the vulnerable, etc. Making sure that by wearing a mask, you are not only protecting yourself, but it's also a selfless act. You're saying that you care about others. You do not want to transmit any infection that you might have, and neither do you want to pick it up if you're a young person and you take it to your parents or your grandparents at home. Our data from what we have suggests that the older you are, the higher the probability of death. People above the age of 65 in the country with COVID, for instance, up to 18% of them die. That's almost a 1 in 5 chance of death. And if I ask you to cross the road today and I tell you that you have a 1 in 5 chance of being knocked down, you probably wouldn't even try crossing the road. So it's all about effective risk communication and engagement of the communities. Now, answering your question, we have done a lot of work at the grassroots level in terms of mobilization. We have engaged local leaders, traditional rulers. We have gone to the marketplaces to talk about the use of masks, training. We have gone to motor parks, for instance. We have engaged with religious leaders. We have very strong links with religious leaders. But it's also about engaging right down to the ward level. With people that are living within the communities themselves, people that are believable, not doctors that will come out and say this is what you need to do, etc., or at the federal level, but actually getting people that are trustworthy, that the societies and the communities would accept when they talk about issues. From the risk side, our engagement really has been quite robust. But we continue to be quite disappointed with the level of compliance. And I think what's probably happening is at the beginning, people took this very seriously, which is a good thing. People stayed in their homes, people kept away, people used face masks. But over time, it's human nature for us over time to get fatigued, to get tired. But what we need to remember is the virus itself does not tire. The virus is there waiting for an opportunity to infect the next person. It doesn't say, well, actually, I've given Nigerians enough hassle, and therefore I will go away. No, the virus is very much comfortable with waiting us out until we all tire and we give up. And giving up is certainly not the solution. We've got to protect ourselves, and we've got to protect the vulnerable parts of our population. We can see what's happening in other parts of the world, Brazil, United States, even parts of Europe where they are having a second wave. We can see the number of deaths over 700,000 deaths are happening most based on the figures we had just yesterday. In terms of Africa, for instance, it's huge. The number of infections that have been going up over the last 1 week. Globally, we moved to the numbers increased by 1 million over just 4 days. Just 4 days, we had 1 million cases globally. So this virus is this pandemic is far from over, and we really need to engage properly. I'm pleased that with most of the state governments, We continue to have very robust engagement. They continue to support us. They continue to provide all the necessary resources required for emergency operations and testing, as well as isolation of people. But as we open up the economy, the message really is your risk of catching COVID is as high as it's ever been. And if you do not need to go out, if you belong to a vulnerable group above the age of 65, or you have diabetes, or you have hypertension, you're the group that should be most worried, and you belong to the group that should really stay at home unless there's a good reason for you to go out.
All right.
Survival is the name of the game.
Dr. Aliyu, let's talk about now that we're about to test the waters, considering the reopening of schools for final year students at various levels. What is the level of compliance from schools and the educational sector generally?
So I'm sure you've seen the Honorable Minister going around some of the FCT schools, yes, and assessing their level of compliance. But I just wanted to clarify, we're not opening schools altogether. We're allowing the final year students to sit for their exams. And the role of the PTF is really to assess whether or not something is safe enough to do, and if it is safe enough to offer guidance in terms of how we can mitigate any risk of infection. The number of students going in for exams it's very small compared to the overall population of students across the country. And when you think of the classrooms that currently exist and the teachers, it should be possible to spread students out, to maintain physical distancing. And because they are final year students, it's also easier to put out the messaging around protection, the use of face masks, etc. We really don't want to have any spike as a result of opening up the exit years. I doubt we will, to be honest, because if the guidelines that we have laid out are followed strictly, the risk of any sort of major transmission is really cut off. It's really reduced remarkably. Of course, you cannot eliminate risk altogether, but what we have put out in terms of the guidelines, if they are followed strictly by the school authorities, it should be possible for students to sit their exams and to write their exams and complete their year. What we don't want is a situation where the COVID pandemic is over in the next 6 months to a year, and then we have a huge impact on our educational system that will take years to recover. These young people, they have their lives to live. We really should find a way to make sure that they are able to sit their exams and move on next year to other educational pursuits. So we're confident from the PTF side that we have done our bit, and we hope from the side of the major stakeholders, they will do their own bit as well to make sure that students remain safe and are able to do their exams and go back home safely.
Now, how about testing? Based on the numbers we have, there are some quarters who believe that it's because we're not carrying out enough tests of Nigerians that the number we're testing compared to our population is still very low. Are there efforts to increase the tempo in terms of making sure that as many people are tested as possible on a daily basis?
Yeah, absolutely right. We certainly know that the number of tests we are doing per capita of the population remains relatively low compared to other countries such as South Africa. But remember, Nigeria is quite a large and complex country. We started off with just a few labs. In early March, I think we had 3 or 4 labs that were molecular labs that could do the testing. We now have just over 60 laboratories all over the country. In fact, only 6 or 7 states do not have a molecular lab, and we hope over the coming weeks that we'll be able to get every state to have a molecular lab that has the capacity for testing. But it's not just about having the labs. It's also about getting the cooperation and engagement of the public. In some parts of the country, what's happening is the demand for the test has virtually evaporated. We have labs that were operating far below their capacity. So, for instance, if all the labs that we have, the 61 labs or so that we currently have, if they were all operating at full capacity, we have the ability to test more than 10,000 persons per day,
Okay.
and a lot more. But we are operating far below capacity because people are just not coming forward. Now, this is all part of the reason why we have to upscale our risk communication strategy. Why are people not coming forward? Well, first of all, there's that issue of fear and stigma that comes with having COVID infection. Secondly, there's also the knowledge that might be lacking in terms of where people go for testing. And we are addressing that by introducing sample collection centers in all the hospitals, all the major hospitals, as well as the local government facilities that have a high throughput, so that people, when they feel sick, what do? People go to hospital. If they go to a hospital and there's a sample collection center available, and then it makes it much, much easier. We are also working with the communication people to have a simple helpline rather than the current complex network of telephone lines across the states, where people can just dial in if they need a test done, and they can walk in and have the test done. So it's not just about the number of laboratories or the number of commodities we have for testing, because from the laboratory side, we actually have enough test kits. We have enough test kits at least to do 250,000 at the moment, at a go. So that shortage of test kits is no longer the issue. The issue is getting people to come out and test, especially in the first place, and getting people to understand some of the symptoms. If you're a young person, it's unlikely you're going to have very severe symptoms. 80% of those that catch COVID will just have a mild illness, but there are certain characteristics of the illness that makes it different to your normal cold. So, for instance, the loss of smell and loss of taste is so characteristic of COVID. The issue of coughing, the issue of having a fever. Most people would have some form of fever over the period of their illness. And the younger you are, the less likely you are to have symptoms. But that doesn't mean you will not transmit to others and transmit to your household, etc. So if you have a cough, if you have a fever, you have shortness of breath, or you have a bad cold that results in a loss of smell, get tested. Because so far, certainly the ones that I have seen, virtually all the calls I get where people want to be tested and they say that they have lost their sense of smell. When we test, it turns out to be COVID. So having that knowledge and being able to know also where to go and easing the process of accessing testing is so critical. From the government side, we continue to work very closely with our partners and also with the parts of the media and the religious and community leaders to push out this messaging. It's in your best interest, if you have the symptoms, to come out, get tested, and isolate yourself so that you do not transmit. If all of us followed the guidelines that we have set up, the use of face masks, the hand sanitization, keeping distances, etc., this pandemic will be over in the next 4-6 weeks, and we can get on with our lives. But if we do not change our behavior, if we continue to assume that, this is just people hyping about an illness that is not severe, then this thing will continue to drag for months and possibly a few years from now until a vaccine comes out. And we certainly wouldn't want that to happen, because it will adversely affect our economy. It will affect the ability of government to deliver services, and overall it will affect our livelihood. So it's in our best interest to come together and fight this monster of an illness, so that we can get on with our usual day-to-day lives.
All right, if you're just joining us, the program is Have Your Say, coming to you live on the network service of Radio Nigeria. And today we have with us the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu, who has been discussing on efforts being made by the federal government to contain the spread of COVID-19 in the country. It's now time for us to go for a short break. But before we do, let's announce the phone lines so that you can get ready and be part of the conversation. The phone lines to call are 0807 622 6771 and 0705 149 3324. Stay with us. We'll be right back.
Radio Nigeria, uplifting the people and uniting the nation.
Una no vex. Una never hear of coronavirus. Prevention is better pass cure. See this hand sanitizer. Now one way to take prevent coronavirus with that. See, another one we say we can wash our hands clean with soap and with water. Another one we say when we want sneeze, I mean we want cough.
You do it into your bent elbow.
Then if it be like say you no feel well, whether na cough or I be you no feel breathe well, I be you dey feel feverish for this period. I beg make you take sign how. Then the one wey make I no feel hug you. And they call am physical distancing. Nigeria, our culture they promote cleanliness. Let the celebration.
This message is from FRCN and NCAC.
Radio Nigeria, uplifting the people and uniting the nation.
Thanks for staying with us. The program is Have Your Say, and we're looking at checking the further spread of COVID-19 with Dr. Sani Aliyu as our guest. That is the National Coordinator PTF on COVID-19. It's now time for us to take calls. Like we said, the line to call is 0807 622 6771. Once again, slowly, 0807 622 6771. Remember, you can also send us SMS and WhatsApp only on 0705 864 2473. Once again, for SMS and WhatsApp only, send to 0705 864 2473. Also, remember, we're streaming live on www.facebook.com/Radio Nigeria Network, or simply search the Radio Nigeria website. So, back to you, Dr. Sani Aliyu. Now, what is the level of cooperation from the private sector? At some stage of the pandemic, there were some Nigerians who decided to just go to private hospitals to either seek treatment or find out if they can run tests and so on. At this stage now, are we seeing a change in terms of integrating the private sector, the private hospitals in the fight against COVID-19?
Oh, definitely. In fact, it's not just the hospitals, it's actually the laboratories. Increasingly, a significant number of private laboratories have now come into our testing network. And this is particularly important as we try to open up international travel, because we don't want a situation where government takes up all the costs for travelers having testing. A lot of countries are requesting for PCR tests and having a negative result before you travel. So we are encouraging private laboratories to engage with the NCDC and to get registered and to get accredited for the purpose of testing. When it comes to hospitals, a lot of the private hospitals now are starting to show interest in providing care for persons with COVID. Our infection control pillar, which is part of the NCDC setup, has been doing a lot of training for healthcare workers in the private sector. Certainly in Lagos and in Abuja as well, we do have private hospitals that are able to take up persons with COVID and look after them. Some of the best facilities for intubation and ventilation of patients with severe respiratory failure due to COVID are actually private institutions. So every little can help.
Dr. Sani, just hold your thought. Let's take this call. We have Nigerians trying to reach us. Hello, tell us who you are and your location. Yes, good morning.
This is Bishop Isong from Sabugudara, Edo State.
Yes, please, Bishop Isong, please go ahead.
Thank you very much. I agree to our guests. This issue of COVID-19, I've had cause to say it, and I will reiterate all I've been saying before, that as a matter of fact, people have been sanitized enough. Although there's nothing that is too much, they will still appeal that sanitation should still go on. But to the best of our knowledge, every Dick and Harry in my area, they are aware of it. But the problem we have now is this idea of enforcement. How to enforce the law to ensure that they comply. I would say that one. I think like this, elderly people who have this problem, like diabetes, hypertension, and so on and so forth, in order to reduce the rate of death, the rate of fatality, I will advise and suggest that government should give them free medical care. Anybody who has diabetes can go to the nearest government hospital, and you should have free treatment. The same goes for this hypertension and so on and so forth.
Right.
Because by the time we do that,
all right, Bishop, please round
the
up.
rate of fatality, as far as COVID-19 is concerned, will be reduced. Then
Right.
going to the idea of opening schools, like I said before now, that this idea that if we have to open schools, we should do it gradually. And I'm happy that the government has heeded to our call. The terminal classes, good. And they are resuming now. We all know the best bet for them is to ensure that they comply with the NCDC laws.
Round off, Bishop,
mask,
round off, Bishop Song. We don't have much time. Hello? Okay. Yes, let's take more calls. Hello, tell us who you are, your location, and go ahead. Please make it short. You have less than a minute. Hello? Hello, are you there? Hello, caller. We have a caller. Are you there?
Saturday.
Hello?
God.
Hello, we didn't get your name. Yes, we can hear you now. Go ahead, please. Your name and your location, and then go ahead.
My name is Emmanuel from Amadiama, Port Harcourt.
Emmanuel, yeah. Go ahead. Good morning, Emmanuel.
Okay, sir. It is concerning the COVID-19 of the issue about this COVID-19, sir. The only thing is that presently, it seems as the disease has come to stay with us here. But there are some certain things that we need to do to put in place so that the economy will still go on, life will still continue. In terms of school, that is the most aspect that I called on because it's really affecting the youth, especially those that are in school. Hello, sir. Are you hearing me?
Yes, we can hear you. We can hear you.
Sir, especially those in now that the secondary school has started, we really hope that the university also follows suit because the youth presently, they are really tired at home.
Okay. All right. Thank you, Emmanuel. Thank you, Emmanuel. Dr. Sani?
Yes.
Okay. Yes, I'm sure you had those contributions and questions and observations.
That's right. So Bishop is quite right. Whenever we do our polls, we do weekly NOI polls where we poll over 1,000 people throughout the country and over 1,000 in a specific state. And some of the questions we ask is, do you know what COVID is? Do you know how to protect yourself? And more than 90% of the persons that we poll always say, yes, they know what COVID is. Yes, they know what the protocols are with regards to prevention. But it's really translating knowledge into action that becomes the problem. In other words, people complying with the knowledge that they have with regards to protection. And here, this is where the issue of enforcement comes up. But sadly, when it comes to behavioral change, enforcement in the long term really doesn't work. What you need is to convince people that it is the right thing to do, to convince people that it is in their best interest to do something in order to ensure that behavioral change is consistent and maintained. When it comes to the use of face masks, some of the things that we have recommended is, for instance, where there are services being provided, whether it's entering government offices or restaurants. Restaurants, most restaurants are closed anyway, but services in general, if you're not wearing a mask, you're not allowed in.
Yes.
So no access if there's no face mask and no service provided. And certainly within the government offices in Abuja here, we're enforcing that. But it also takes the community to consider that whoever is not wearing a mask going into a mass gathering or a public space is putting everybody at risk. When I come across somebody without a face mask coming towards me or trying to talk to me, I immediately pull back and ask the person to put on their mask. Even if they have a mask on their face, if it's covering their chin, it's a waste of time because you need the mask to cover your nose and your mouth as well. So it's our responsibility, it's a collective responsibility to consider the issue of protection of particularly of our vulnerable groups. If you put on a mask, it's a selfless, it should be shown as a selfless act, an act. In other words, you're showing that you care for others more than you care for yourself in terms of protecting others from this disease. So the issue of free medical care for the elderly, yes, so this is something that will have to be taken up post-COVID. We know the challenges we have within our health sector. We know that we are starting off from a very weak base. We've been lucky as a country that we haven't been impacted so heavily with COVID compared to other parts of the world. But definitely we need to look at how we deliver our healthcare services moving into the future, particularly for people who cannot afford to pay for healthcare. At the moment, our primary healthcare facilities are undergoing renovation. I strongly feel that the first part of the job post-COVID is to really upscale the provision of primary healthcare across the country so that people can have access to affordable healthcare and also improve health insurance beyond just government officials to include the private sector. The other gentleman talked about the need to open up the economy, which is absolutely true. Even the developed countries have suffered really badly from the COVID pandemic, and this is why we're taking things at a stage at a time. We do not want to rush and open up everywhere because we could end up having another wave and going back to square one where we go into a generalized lockdown, and that's why all the recommendations we make to Mr. President are always data-driven. They are based on sound science. They're also based on the experience of other countries. How did they open up? Aviation, travel, for instance, we've opened up domestic. We are now working towards opening up the international route. When it comes to businesses, government work, etc., initially we said everybody stay at home. We then allowed people from grade level 14 to work, and we're now going to review that later on today.
All right.
And again, when it comes to commercial services, banks, etc., we did the same. Everything is stepwise, but the economy has to open up. It's really critical that we get back to business.
All right, Dr. Sani, let's just hold your thoughts. Let's see if we can take. We have some callers trying to reach us now. Hello. Yes. Good morning. Tell us who you are.
Good morning, Doctor. Yeah, I am Comrade Mazi Patrick Okoro Krap, calling from Owo Blue Village, Ratari Aruchuku, Abia State.
All right.
Doctor, you see, today, the YH students we are talking about today, those who are writing this SSC, at least, they have over 1.5 million candidates writing the exam. And NECO will soon come to ANAPTE. I'm just suggesting that the federal government should make it compulsory to the State Ministry of Education that they should go around to the school and make sure that they have temperature check. Nobody comes to the gate without being checked before entering the because it's very, very important. Very, very important in the sense that we make policy, but it's not being implemented and monitored. That is need to do this. Because if you go around now, some students now come back with only one face mask, some two. There is need for that at least to have excess. In Aba, they produce face mask 50 naira, excess. The highest one is 100 naira. Maybe you want the Oga owned. That one around 1,000. That will not be 50 naira, 100 naira is good for them. Now, the question now is this. How is the presidential task force with the state assistant monitor these exams? Because go around and make sure that the student that the school authority makes use of classrooms or hall. If there is class, at least they can take 10. Because this is whereby the school want to save costs at the detriment of the students. It's not healthy. And the PTA authority should come in now. Whether you are working or not working, you are part of the PTA school, arrange yourself and make sure you help and monitor these exams for the students because the health of our children is very, very important.
All right, thank you,
Comrade
Patrick.
Have a blessed day in Abuja.
Thank you very much, Comrade Patrick Okorafo. Hello, yes, tell us who you are on your location and go ahead. Hello?
Hello.
Yes, please, good morning.
Hello, good morning. It's Adauna, I'm calling from Jos.
Okay.
Good morning, Doctor. I must commend the proposal that the presidential task force of COVID-19. They've done very well, honestly speaking. I don't need to miss the update. It's very interesting. Now, what I gathered out there in the media, I don't know whether it's correct, or sometimes we have, fake news. there's this impression that the federal government is taking care of only its own schools. That is in terms of the contamination. If they are doing that, please, I'm appealing to the federal government to make sure they extend it to the private schools, all the schools where they are going to have these centers. Let them be contaminated, at the cost of the federal government. Let it be one thing, at least the people who are going to seek for work can gain from the government. Then another one is testing. Doctor, why are we not among the countries that are involved in the testing for the vaccine? And I hope it will not affect our having access to the vaccine when it comes out. I don't know whether they will do preference to those that are involved. I know that South Africa is among the countries. So I want to know from you why. Then again, can people now just go and just test without having any symptoms or coming in contact with somebody that comes down with COVID-19? I want to also get, I'd rather go in and test, have the test for free now. Then again, the testing for each state. I don't know if people are given a target. Why don't people give a target for each state according to the population of that state? Because some states are not testing much. That's why they are having very low, numbers. And that will be counterproductive. If any don't test very well, after they will infect the other states. Because we are very mobile. People travel a lot. So
right,
please, people have a target for each state.
All right.
That's it. Okay, God bless Nigeria. Let's not give up.
All right, thank you, Adanogo. Thank you so much. Let's see if we can take one more call. Then we go back to Dr. Sani Aliyu. Yes, your name and location. Hello. All right. Hello. Go ahead.
Good morning.
Yes, good morning. Your name and location, please.
This is Bishop from Sabuda. I'll call back again.
Oh, okay.
Now, I only want to advise seriously that in most schools, you do not have enough teachers. Here in Edo State,